Hello and welcome to the Goldberg Clinic for Chronic Disease Reversal located in Atlanta, Georgia. My name is David Tenner. Dr. Goldberg and I recently attended the 2011 National Health Association Conference in South Florida. At the conference, Dr. Goldberg was one of the keynote speakers. The following is an audio recording of Dr. Goldberg's first lecture at the conference, titled Connect to the Earth.
Hi everybody, it's very good to be back with a natural hygiene crowd again after many years. I am a professor at Life Chiropractic College. I'm also a private practitioner up in Kennesaw, Georgia, that's outside of Atlanta, where I direct a clinic for the reversal of chronic diseases. The presentation I'm going to be making for you this morning is actually one that has had pieces of it given to professional medical crowds and professional chiropractic crowds, but it's really the first time I put it together kind of in a coherent, hopefully coherent fashion for you today. And it's titled, Connect with the Earth. Do you like Jack Russells? I happen to favor Jack Russells myself. One of the things, and I've been in healthcare since 1975, at which time I actually worked at a place where Dr. Sabatino is familiar with, also called the Shangri-La Natural Hygiene Institute, which used to be in Bonita Springs, Florida. I was the health director there a few years before Frank came there as health director. And when I came down there, you get a certain education in hygiene, and I went on to study at the University of Texas Medical Center and later became a chiropractor and worked for the U.S. Public Health Service and did chronic disease epidemiology. And you get different viewpoints. And you look at specifics here and specifics there, specifics like microbiology and gastroenterology and rheumatology. And at some point, though, after you get a lot of information, you find that you don't really know as much as you thought. And it helps to look at things from a distance, kind of like that song that Bette Midler thing. So over the years, particularly in the past 20 years, I've kind of looked and seen that sometimes it's a good idea to get away from the academics and just look at things from a bit of a distance. About 40 years ago, I was a very sick man. I had what was termed medically ulcerative colitis, inflammatory bowel disease, and I'd also been diagnosed with having rheumatoid disease or rheumatoid arthritis. And I was a student at that time at Ohio State University doing a joint degree program in medicine and in law. And it was a very hard program to get into and something I was certainly proud of, but I recognized also that it wasn't going to be worth very much to me if I was going to be as sick as I was. And the medical establishment really didn't give me much to hope for. So I left Columbus, Ohio on a very dreary day, and I went down to the Shangri-La Natural Hygiene Institute. Do you remember that picture there, Frank? Yeah, that was at the old octagon that we used to do yoga in and have lectures in. And I was down there on a co-op program, and I worked there for a while, and driving buses, taking care of the pool. And then Dr. Cheatham, R.J. Cheatham down there, decided I could be health director, and I took over that role. And I became very, very enamored with the works of Herbert Shelton, and I became familiar with Dr. William Esser and other well-known hygienists at the time. Became captivated by it and really saw things in a panoramic type of way. And what I learned there at the Shangri-La, through my experiences and the guidance of Dr. Cheatham and Dr. Esser and others, was to really form the basis of what I would do for until now that I'm 60 years old. But despite all that formal education, as I look back, still the most valuable things that I learned as that young 24-year-old kid that was at the Shangri-La and at the Natural Hygiene Institute down there. And I began to see things a little bit from a distance rather than that kind of microscopic viewpoint that my academic background had given me at that point. And 35 years later or so, I still find it's very, very useful and important with each patient that I see to try to help them not only look just at very specific things about their exercise and their diet and the sunlight they receive and the water that they drink, but also to look at a little bit of a distance and take a panoramic view and see how it is that they are either connected or disconnected from planet Earth. I've come to the conclusion, rightly or wrongly, that it's important to know how we connect with the planet itself, with the Earth itself, or conversely, how we're not so connected with the planet or the Earth itself. And if we're connected well with the planet, we're connected well with the Earth, and it allows us to look at things from a much deeper level, and that's simply looking ourselves in a more piecemeal type of fashion. You know, we know that something's wrong. We have a population of people that are sick, and they're depressed, and they're frustrated, and they're fatigued. We have a population that about, or actually now over 1/3 of us are now going to get cancer in our lifetimes. Hopefully not any of us in this room, but we know statistically it certainly is a big danger out there. We have cancer right now as the #1 childhood cause of death in this country, exceeded only by accidents. 1 out of every 10 people at any one time is on an anti-anxiety drug of some type. And most adults have at least 1 or more diagnosed chronic disease problems. So we have a population, and those of us in practice, we see people that are toxic every day for one reason or another. Many of them are toxic for reasons that fasting and that food and dieting alone will not resolve. And they're frustrated. I mean, one of the big emotions I see in people that come into our office is people are frustrated. They're angry that they haven't been able to get well, and that the help they've received from physicians has not enabled them to get back to the level of health that they would like to have. You know, and patients are always looking for some way to fix what's wrong with them. They're looking for fixes. They're looking for the newest surgical procedure. They're looking for the newest pharmaceutical agent. They're looking, and this is a problem now too, they're looking for a plethora. Do you like that word? I like that word, plethora. They're looking for a plethora of alternative medicines, looking for herbs and homeopathic supplements and all kinds of alternative things and therapies that they can use. They're looking for the latest and greatest detoxification therapy. They're looking for the latest and greatest diet. Oh, if only I could find the perfect diet for myself. And they're looking for the newest so-called nutritional approach. But you know what? It's not their fault, because that's how doctors, alternative, conservative, non-alternative, homeopathic, naturopathic, allopathic, chiropractic, that's how they've oriented them, to take those drugs and take those herbs, get this surgery, take this therapy, eat this, don't eat that, fast, don't fast, follow my diet, the best diet ever, take this homeopathic agent, get your spine adjusted 3 times a week for the next 1,000 weeks, exercise harder and do it like this, bend, stretch, breathe, don't breathe, do this, don't do that, lift that barge, hoist that bale. And, you know, it's frustrating. And it's confusing. Been there, done that myself. And so patients come to our office and other offices too, searching for why they're ill, and they need answers rather than just Band-Aid treatments and hype. So I propose a new paradigm, and one that is based, however, in natural hygiene, and also based, my background too is in clinical epidemiology. And rather than looking for cures, we look for specific causes of illness in each and every individual, understanding that every one of us has a lot of similarities, but there's a lot of differences between us as well. We're different from each other too. I like the word transformation. See, the goal of healthcare, which we in hygiene believe should be termed self-care, should be to empower an individual to really go through a process of transformation, to transform themselves from whatever it is they're at to wherever it is that they need to be and they want to be. To transform unhealthy tissue into healthy tissue. To transform fatigue and pain and depression and poor organ functioning into organs and glands that function efficiently. And all of this, in my mind, requires that each and every one of us looks at the ways that we're connected or disconnected from the earth. And you see, I'm kind of dangling that little thing about how the connections are from the earth between us as being something that determines the level of health we want to reach. So when somebody comes in my office and I see that they're having joints that are hurting, or they're having skin that's hurting, I say, what is it about this patient that's not right about their transformation of air, water, food, and I would say thought? They don't have healthy skin. They don't have healthy joints. What is it about this person that they're not transforming air, water, food, and thought into healthy joint tissue, or healthy glandular tissue, or healthy immune cells? See, because most chronically ill people, they do have the potential to be healthy if they can connect with the earth and if they can transform air, food, water, and thought into healthy tissue.